So my hip exercise that I'm adding to this rehab library is the lateral banded walk. Typically, we're going to be giving this to guys with any sort of ankle injury, knee injury, or hip injury. It's a really good activation of your lateral hip musculature. So it's a really good way, especially for guys with knee and hip injuries, to cue them to use the lateral aspect of their hips. We use this a lot for guys to train their hip muscles that they're not really using, and also as a good way to get pre-practice activation before they go out. So I'm going to get into the video in just a second, and then I'll get into all of the parameters, indications, and progressions and regressions. All right, so typically we are introducing this exercise in the strength phase. We want guys to at least have some function with weight bearing in order to do this. That's really the only sort of thing that you need to have before there, because this is really not as much of a range of motion exercise as much as we want to increase the strength of your lateral hip musculature. So really introducing that in the strength phase, and then we'll kind of get it into the power phase, and we'll still include this for a lot of guys with maintenance, but really only this does the most work in the strength phase. So typically what we'll do to prescribe it in terms of parameters, we're going to pick one spot where they start and one spot where they end, and we're going to say, all right, I want you to go down and back 3 to 4 times typically. This is sort of an in-between between a strength exercise and an activation. We love to have guys do this as an activation before practice especially, but typically it's about 3 or 4 laps down and back. So to progress this, in the video I had the band around my knees. If you want to use the same resistance to progress that exercise, you could just bring the band down to your ankles to create a longer lever arm and make that more difficult. Other than that, you could also just have a different band, so a heavier resistance, as well as also using ankle weights or any sort of other resistance to make stepping harder. And typically for those, we're just going to sort of, as we progress it harder, we're sort of going to reel back on the parameters. So if we're going to do like 3 or 4 laps with an easier weight or an easier resistance, when we're progressing, we're really going to do like 2 to 3. So it's sort of in that same vein. If you want to regress it, kind of in the reverse, you just do a lighter resistance band, or you could do lateral walking or lateral shuffling. And as for discontinuing it, we're really only discontinuing it once this athlete is having no pain and difficulty completing the exercise, but we're absolutely still going to include this as a sort of maintenance or pre-practice activation.